Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Kim Downey and Todd Otten. Kim is a physician advocate. Todd is a family physician. And we're going to talk about the Kevin MD article, Long-Term Impacts of Physician Suicide on Patients and Doctors. Kim and Todd, welcome back to the show.
Thanks, Kevin.
Thanks
All
for
right.
having us.
So, Kim, we always start with you. You always bring us together as a physician advocate. Tell us what about this article appealed to you to bring it to Kevin MD.
Sure. So I had Dr. Michael Hirsch, who you know, and Todd on my YouTube channel last fall to celebrate us each having a year of podcasting under our belts. And the plan was to talk about that and also the power of connection. And as I introduced the topic, Todd chose to spontaneously share that he was coming through a rough patch, partially stemming from unprocessed grief, including the deaths of four of his physician colleagues from suicide. And Michael went on to share some things that he had learned in his trauma-informed coach training, and including that connection mitigates trauma. And I too have experienced resurfacing of the traumatic impact of my own doctor taking his own life. And it's just so deep, and Todd feels it too. So after recording the episode, I reached out to Todd and asked if he'd like to collaborate on this article because it's just so meaningful to both of us.
And Todd, why don't you go ahead and share more about the article and your story?
Absolutely. And Kim's spot on. When going through school and stuffing everything into a box is just not the way to go. And when my box of previous trauma got opened last summer, it created a bit of a roller coaster for myself and my family, that we're still working our way through. And having gone through it now and realizing it, I can appreciate how our colleagues get to the point where they feel like there's no hope.
Mhm.
And I think that's a big part of why this epidemic of physician suicide is out there and why I had the unfortunate experience of having four of my colleagues that are no longer here. And I think we have to just keep talking about this. We have to make it okay to not be okay and to reach out and ask for help and remove those barriers that exist when people need treatment.
So, Todd, I could only imagine one physician colleague committing suicide, but you unfortunately had four, and I'm so sorry to hear that. Tell me, just so those who just simply can't understand it, tell me the effect that that has had on you.
Oh, wow. There's a lot of layers to the effect, Kevin. Some of it is I didn't grieve some of those losses like I should have. And that in and of itself is a tragedy.
Mhm.
I think the biggest effect it's had for me is my drive now to make change, and hopefully on massive levels, if you will. For those maybe watching, obviously I'm involved with Medicine Forward and we're all about catalyzing positive change. We're working on a documentary to really peel back the curtain on this issue for the American public so they can really understand what's going on with their clinicians. Because as Kim said before, it's magical when that relationship is there between a physician or a clinician and a patient. It's just magic, and so much healing can occur, not just for the patients, but also for the clinicians. And so those losses of my colleagues over the year have just propelled me to keep going forward to make the necessary changes out there.
So, Todd, when you said that you weren't allowed to grieve properly, so that really speaks to me because as physicians, we're often accustomed to kind of soldier on, see the next patient, despite everything that's happened to it, despite all the trauma. So, when you say that you didn't have time to grieve properly, what would you have liked to have done?
Well, I think in particular for my partner of 3 or 4 years, and I won't say his name,
Hmm.
he died by suicide, and it was really a horrific way that it occurred. When I went to the wake and I cried at the wake and maybe started that processing, but I immediately reverted back to my training to just stuff it in a box, put that on the shelf, and keep going. I mean, I was seeing patients the next day.
Hmm.
We need to allow time to grieve and process and heal. And that's not built into our fee for service, productivity model that we've got. And what is really problematic about it is all the secondary negative effects that occur when we're not doing what we should be doing costs way more money, and there's all these downstream effects that often lead to disastrous outcomes. So what I would have loved to have had is, a counselor or a therapist there
Mhm.
around that come in and say, hey, how are you doing? How are you feeling about this? I think that in and of itself might have been enough for me to say, you know what, I do need to spend a little bit of time processing this loss. And that's just a simple example. And I think about the group I work with now, emergency care specialists. They have a therapist employed. We can just set up an appointment and go in and talk about these
Mhm.
things and vent and let that pressure valve release. And think about how that positively affects the culture of this group, right? Their retention is through the roof. People want to come and work there. They're happy because they have these opportunities to go and heal from some of the most devastating things that happen. So that's what I would have loved to have had back then.
Kim, you mentioned unfortunately that your physician also died by suicide. So, speaking from the perspective of a patient, tell me the impact that event had on you.
Sure. Well, it was the most traumatic thing that's ever happened to me in my life, and I've had a few miscarriages and watched my dad take to his last breath. But just, I think, and it was at the tail end of, me having three cancers and just everything that happened. And so it was traumatic. And when I was trying to move forward, after a year, I thought I should be feeling better.
Mm.
But Michael Hirsch, Dr. Michael Hirsch is my physician coach, and he was saying, no, nobody can tell you what to feel or how you feel, and that I was almost beating myself up. That was adding to it, that I was judging myself, that I was still feeling grieving deeply about it. And then I thought I was going to have to bring my mom to that place for her own tests, and it was almost like a PTSD,
Mm.
and I didn't, but then I had to go for myself because I just had another surgery. And I was really had a lot of anxiety about going back there. And it ended up feeling a little hollow and empty because when I did go, nobody was there from just a couple years ago. So it's like nobody knew what transpired that day. And then also part of what I wrote in the article is if now I receive envelopes, people don't like to get envelopes that are like medical bills.
Yeah.
But for me, I know if it's a bill, but if it's not, I'm afraid that something happened, that it's a notice about something happening to my doctor, because this happened a couple times that they were sharing that another doctor in that practice was leaving, and that's what the notice was about. But I get this traumatic response. And even just this Sunday, my doctor shared that he received a promotion. And my first thought was I got teary and I was like, is he still going to see patients? Because,
Hmm.
like, it's just a traumatic thing that I'm fearful of losing my doctors.
And Kim, before you went to Michael Hirsch for therapy and got better after seeing him, you said one thing that caught my ear is that you judged yourself in that year after your physician's suicide. Tell us more. What do you mean by that?
That well, I kept thinking that as time went on, that I either shouldn't be feeling it so deep, because I actually only met him three times
Hmm.
and talked to him on the phone three times. So the fact that he got that much in my heart, but everything that happened is I've shared my first tribute, my first article to you was about him, and the first podcast I ever did was talking about him. And, because the things that happened were unusual, but I think in retrospect that those things were meant to happen, because I think sometimes when something traumatic happens, that's what propel people to find their purpose or their mission. So if that didn't happen, I wouldn't be doing any of this. And people have shared with me that I'm making a big impact. But I just felt like I only met him three times. I only talked to him three times. Like, why is this affecting me so deeply? And I'm a physical therapist, and I was on the ambulance corps when I was 16. So like I've seen people die, and then I've dealt with suffering, just like doctors have, and nothing ever affected me this
Hmm.
deeply. But again, as Todd said, there's some things, just hearing doctors talk about these things, I realized so many things that I never unpacked too. Like I've walked in, you think you're going to see a patient and they're not there. You find out you die and you have to go into the next room. So there's a lot of things that doctors experience where they might feel alone and they don't talk about it. But actually, PTs, we never talk about it either.
I think, one of the things it's become very obvious to me recently is that trauma, whether we're talking big T's, little T's, micro trauma, or whatever, however you want to call it, affects all of us in one capacity or another. And the more I'm getting into my own journey with this, you've got to embrace it. You have to lean into the pain a little bit ultimately to heal from it. For a long time with my partner, I felt guilty,
Yeah.
because I never asked him how he was doing. And I think about that and I get teary even thinking about it. I wish I would have just asked him once.
Hmm.
And that might have been all the difference in the world. But we've got this culture of, just I've recently been joking lately, suck it up, buttercup. Well,
Hmm.
we have to get away from that. We have to, we're all human beings. Everybody has emotions and families and things they want to accomplish. And we have to appreciate that. And I think, going back to what you said, Kim, I think that's why some of these relationships are so meaningful and have such a big impact because we're being vulnerable. And that vulnerability strengthens that bond, very quickly with doctor patient. And I totally get what you're talking about, why it can be so devastating.
So, Todd, I was going to ask about the next chapters in your journey. I know it's an ongoing healing process; it could never be completed. So, talk about some of the things that you've done to help yourself along with that healing process. What kind of changes have you made?
Well, probably the simplest one, I never really realized that I was always running from a lot of these things
Hmm.
and not necessarily staying in the moment, and that could be at a kid's game, right? Like where you're there, but you're not really there, and you're kind of numb because you're trying to protect yourself from all this other stuff that's occurred. So that's one thing, just trying to stay in the moment, and it's okay if it's not perfect, right?
Hmm.
And there's going to be mistakes made. I've learned to be more compassionate to myself. As a physician, you get 1,000 feedbacks, and if 999 of them are positive and one of them is negative, which is the one that you're focusing on and spending all the time worrying about that one,
Hmm.
right? I mean, you can't live like that. That's not healthy. Some of the personal things that I've been doing, and I think it's important to share this so that our younger colleagues know it's okay, is going to therapy. I'm planning myself to start some trauma informed coaching. I recently been doing some EMDR, movement desensitization reprocessing, so that those previously very painful memories don't take over a day and make it miserable. So, but it's a lot of work. I never I never really realized how detrimental compartmentalizing stuff and then never going back to it really truly was until this past year. So yeah, a lot, and hopefully by having these conversations, it empowers and inspires our colleagues to ask questions or maybe reach out to a colleague and say, "Hey, are you okay?
Hmm.
How can I help?" And that might, like I said, that might save a life. It really might.
And Todd, just those simple questions, asking about someone's mental state, simply just asking how they're doing, sometimes it can uncover things that ordinarily they wouldn't be vulnerable about.
100%. I mean, the floodgates could literally open. And I think what's amazing about that, Kevin, I think there's a lot of people out there who are just desperate to have one person
Yeah.
be attuned to what is truly going on and saying, "Oh, they're not okay." I think back to the times I was struggling. There were, went through, people will say what they will about the word burnout and, is it depression or is it moral injury or all these other things. Having lived through it, I think people can kind of resonate with that term a little bit. So I tend to stick with it and they can appreciate it. There were so many red flags
Yeah.
during that period. I mean, me walking out of the clinics just beyond upset and just basically leaving in the middle of a clinic day, walking out of a meeting in tears. I'm glad those things happened, Kevin, and Kim, because it's led me on the journey I'm on now. Do I wish somebody would have asked back then? Yeah, but everything happens for a reason. And I think, the work that's being done by Kim, myself, by you, Medicine Forward, all these other wonderful organizations out there will get us to a better place.
Kim, we talked earlier about the power of connection, and you've been at the forefront of this, connecting doctors over the last couple years in terms of getting us to be vulnerable, talking about our stories, talking about our trauma. How about you yourself? How's that power of connection helped you in the healing process?
It means everything. In a lot of my own healing, I feel like when I talk to these doctors, we're helping each other heal. Like they feel, like somebody who just wants to talk, that it doesn't want something from them, and that's why I think lots of times if they find me on LinkedIn, sometimes our first communication is like in a private message and they might share that they're miserable. And then I'll say, do you want to have a chat? Or they'll ask if we can chat. And then I just sit and listen to them. And then I also had done an introductory episode for my YouTube channel. It was like between episodes 3 and 4, where I just share my story as briefly as I can in 20 minutes. So sometimes, like, I share that, and if they haven't seen it, I just kind of share it in a few minutes.
Hmm.
And they really appreciate that someone who's been through a lot and even had some negative experiences is trying to take the like a positive route and make an impact, for doctors, and they appreciate that. So just having our conversations together is healing for both of us. And then sometimes they're hesitant, I think, to reach out to other doctors because they kind of feel siloed. So when I talk to somebody, I give them shout outs on LinkedIn,
Hmm.
and then my doctor friends feel comfortable then reaching out to them. So and actually that's what happened with Todd and Michael, right? Once I talked to, the two of them, and then they had a phone call themselves, and then I had them on together. And then, like, I help other doctors deepen relationships with each other. So I feel like they say that phrase, we're all walking each other home.
So I'm going to ask each of you next the same question in terms of what physicians or clinicians listening to you on this podcast, what are some things that they can do? Because I'm sure that the stories that both of you share isn't unique. And there are a lot of clinicians who are just hiding and suppressing these stories. So, Kim, through what you've learned with all the different connections that you made, what are some pieces of advice that you could share that could really move the needle with some of the doctors who may be undergoing trauma or repressing trauma? What are some tips that you can share?
Well, I would say one thing, and whether you're on the receiving end or would like to offer support, is when you say, hi, how are you doing or something, right? Everybody just says, I'm fine. But if you slow it down and you ask again, like, how are you really doing?
Hmm.
And if you look them in the eye, then that can make all the difference, because then they're getting the sense that you do really want to know and you do really care. So on the giving end, that is something that I would and to do that regularly, like if you're in a good place yourself, to just check on, or your friends, like anybody, just check on that. That's what they say now, a friend check, right? But it's really important. And then if you are a physician that's struggling, as we've talked about, sometimes, like, if you are in a bad place, even asking for help can feel like so much work. But that's what you have to do. You have to find a safe person just to tell something to, whether it's, a friend, a pastor, a coach, a therapist, anybody. And there's people out there that can help you if you don't know where to turn. Any of us, right? All of us would have resources. Send, any of us a message, but just share with somebody. And then, like I said, Todd has shared some things that have, helped him, and that I've heard have helped other people as well, like things like looking into like the EMDR and things like that. So I'll let Todd continue.
Well, I was going to ask Kevin how much time we have, because I could probably go on
Sure.
for quite some time relaying some things that I think would be helpful to our younger colleagues. But just maybe to highlight a couple, I think that, we've talked about relations, we've talked about connections. I think if you're not okay, find a senior physician or reach out to
Yeah.
somebody on LinkedIn or come to Medicine Forward. You know, I want to help the next generation through some of these struggles. I want to make the landscape better in a big way. So I think that's one thing. I think the courage to say no is critically important. We as physicians, we are taught to just keep going and do more and do more and do more. And honestly, that's been abused in my opinion, in terms of productivity in this fee for service world that we live in. And we've got to stop that. So the power of no is critical,
Hmm.
but also self-care is paramount. Like, if you're not well as a physician, you are not giving your best to your patients. And we've just proven that that's lunacy. You've got to take care of yourself. So maybe those are three things that, I would simple things I would suggest.
We're talking to Kim Downey and Todd Otten. Kim is a physician advocate. Todd is a family physician. Today's Kevin MD article is the long-term impacts of physician suicide on patients and doctors. Now, I'm going to ask both of you just to end with some take-home messages that you want to share with the Kevin MD audience. Todd, why don't we start with you?
Absolutely. So one of the things that I'm super excited about at this point, Kevin, is we've got a physician-led, not exclusively physician, but a physician-led group that is working on a documentary that is very much going to hit on this topic. And I'm super excited about it. We're hoping to release it on September 17th of this year, National Physician Suicide Awareness Day. So if you're interested, let me know, and I'll show you that I've got, well, I'm probably not doing it right, an earring in with teal and purple and a semicolon showing my support. So I'm going back to my college days with the earrings. So yeah, if you're interested, reach out. Let me know.
And Kim, we'll end with you. So your take-home messages.
Sure. So I have several things to say because I know that your audience isn't just physicians. So just to kind of encapsulate some of the understanding for people that aren't physicians is that it starts in medical training, through the years and around the world. And besides, Todd's book, Ripple of Change, which is so important, we're all going to make a difference, is I believe you've also had on Simon Craig, from Hurting and Healing, delivering love to medicine and healthcare. And through my conversation, and I've had him on as well, is that's how we know that it's been through the ages and around the world. It's not just an American problem and it's not just recent. And it's like you take smart, compassionate, driven individuals, you set them up to compete against each other for entry to the best colleges, then med schools, then residencies, then attending positions. You teach them the patient always comes first and ignore their own basic human needs like sleep, food, water. If you're in a surgery and they don't give you a water break, connection to family and friends, your mental and physical health, not to set boundaries, not to say no. And then you pile on repeated exposure to human suffering, trauma, and death with no training or support to process it all. And in addition, many doctors have their own personal history of trauma, even going back to childhood, and heaped onto all of that, which many times they've never unpacked. And you dump them into a system where they have an incredible amount of responsibility, yet so little control. And they often have at least a couple $100,000 in loans to repay.
Mm-hmm.
And so it's just the whole culture of medicine has to change. And one thing every single one of us can do is thank a doctor. And as you know, Kevin, I've just submitted an entire collaborative article speaking to that with the goal of making a huge impact for Doctors Day, March 30th. And let doctors know that you understand how hard things are right now and how much you appreciate them being there for you. And many are leaving medicine, understandably. And we need doctors, and the pressure is increased even more on those who remain. So thank you. You've both received a personal thank you from me with my deepest, sincerest gratitude. And I, mean that with my whole entire heart. And I've started a group that's addressing patient empathy and clinician well-being. So reach out to me if you'd like to be involved. And I'll end with a question. The three of us have each been told we're super connectors, each in our own way. And is there anything else we can do together to best maximize these ripples of change, or are we already doing it?
Kim and Todd, thank you again for sharing your stories, time, and insight. And thanks again for coming back on the show.
Thank you, Kevin.
Thanks, Kevin. It's always wonderful. I appreciate it.